All right, everyone, we're going to get started. Thank you for joining us. Today, we are going to cover the fellowships program in partnership between the IOFF and OF. So we'll share insight into the fellowships program. You can learn about the opportunities available and the requirements for applicants. We have a current fellow that you'll hear from later on, and we'll have a Q&A at the end and also share information on how to learn more after the webinar. So those joining us today, I'm Christine Graham, the Executive Director at the Ophthalmology Foundation. We have Cordella Gabel-Obermeyer, who's the Fellowships Executive. Dr. Deanne Antono is joining us as a current IOFF Fellow, and Jody Hicks is the OF Assistant Director, and she is making sure everything is running well in the background and will help us with the Q&A. So just a little housekeeping as we get started. Use the Q&A box to submit questions. I believe the chat may or may not be accessible to you, but the Q&A section will help us both answer questions while the presentations are going on, as well as pull at the end to make sure your questions are answered. You'll also have noticed that the webinar is being recorded, and we will share the recording in the next day or so with everyone who's registered and also share on social media so that you can link it out and share it with other folks you know who may be interested. So what we're going to go over today is welcome. We are in that right now. I'll share a little bit about the Ophthalmology Foundation for context. We'll talk about the fellowships program, and then a little bit about the international online exams as they are linked closely with the fellowships. We'll have our fellow, Dr. Deanne, share her experience as a fellow, and then we'll end with a Q&A section as well as sharing how to stay in touch with us. So moving on about the Ophthalmology Foundation. So our main goal is education and really improving ophthalmology and access to eye care through education. So we focus particularly in lower resource and underserved countries, but really have a global audience. And we focus on helping ophthalmologists become better teachers, providing training opportunities such as the fellowships, and conducting affordable and accessible examinations. So the 4 key programs supporting our mission are examinations, fellowships, faculty development, and accreditation. So we'll hear about a lot about fellowships today and a little bit about examinations. And then I'm going to share just a brief bit about faculty development and accreditation right now. So our faculty development programs are both online and in person. Everything we offer is free at the moment. We have a 21 module self-led online course on teaching skills. It's available for anyone who is interested. You can pick and choose the modules that interest you, or you can do the whole thing. It also offers CME credit for each module. And then on the other side of online interactions, we have a mentorship program where you can join and either be a mentor or a mentee or both and get matched with folks who match your interests and have an online and occasionally in person, if that works, relationship. We also have a website that hosts a resource library and other educational tools. So we've collected the resources for teaching and assessing from all over the internet and tried to have a resource library that people can browse and access. And then as far as in-person events, we organize symposium workshops at regional and national society meetings. So if you're already going, we would love to see you there, as well as more focused leaders in education courses with, say, a national society. That's 1 or 2 days with a group and a specific agenda that's tailored to them. And then we also have a lot of resources on simulation-based education, both on our website and then in person at meetings, utilizing those resources and how to apply them more deeply. So those are just kind of some areas that we have going on in the faculty development program. There's a lot to choose from, and you can learn more on our website or reach out directly to us. For training program accreditation, these are focused on ophthalmology training programs, residency programs, and it's optional. So a program decides to apply and they want to demonstrate that they're at an international level of excellency as far as like their training program. And then we provide feedback on how they can continually improve. Um, so a little more niche, but that completes the kind of the circle of education programs that we have to support our mission. We're very focused on collaborating with others. We don't want to duplicate anything that's already going on. And so an example is our exams partnerships and working with others to get the best result possible. So for example, we're working with Orbis to create, an exams platform for test questions so that people can try out the format sooner than just jumping into an exam. And that's something that Orbis does that we don't. And so we're very happy to work with them on that. And the biggest collaboration that we want to talk about today is our partnership with the International Ophthalmological Fellowship Foundation. They are separate nonprofit from the Ophthalmology Foundation based in Germany, but we work extremely closely in support of the subspecialty fellowships program. So without further ado, I would like to introduce Cordula Gabel-Obermeyer, who is the fellowships executive at the IFF. And she will share so much more about the fellowships program with you right now.
So, can you hear me?
Yes.
Can you hear me?
Yes.
Yeah, okay, very good. Thank you very much, Christine, for your introduction. Thank you very much to Jody for her support, and thank you very much to Dr. Dian for giving a presentation on your program, which is currently running. So my name is Cordula Gabel-Obermeyer. I am from Munich, Germany, and together with Professor Seitz, who is chairman at the Department of Ophthalmology at Saarland University Medical Center in Homburg-Saar, I am running the fellowship program. So what is the EOFF? I'm sorry. So what is the EOFF Subspecialty Fellowship Program? EOFF stands for International Ophthalmological Fellowship Foundation. It is a German charity that was founded in 2007, and we are committed to enhancing eye care education and delivery in low-resource and underserved countries. We invite you, who are highly motivated young ophthalmologists from low-resource and underserved countries, to apply with us for a 3 months, a 6 months, or a 1-year EOFF OF subspecialty fellowship. These fellowships can be served at international teaching units, which are mainly university eye clinic, but also big tertiary centers in many countries. Immediately after having completed the EOFF OF subspecialty fellowship, our EOFF OF fellows return to their home countries. They resume their positions and take part in programs to preserve vision and prevent blindness. It is for the sake of the local patients and also about teaching the colleagues. Mainly the EOFF short-term fellowships are classified as observerships. There is one exception. In India, for example, it is possible with a temporary registration by the National Medical Council in India to undergo a surgical training in cataract, in glaucoma, or oculoplastic. Since the level of or the standard of subspecialty training throughout the countries is very different, we do not offer a degree and we do not offer a curriculum, because we want everybody to come from his level of expertise to a higher level of expertise. So our aim is to individually support the personal skills in eye care, and we want our candidates to find answers to the daily challenges they face in their work. So this is an overview on the opportunities that we are offering. So the majority of our short-term fellowships is the 3-month fellowship with the in collaboration with the Ophthalmology Foundation. We have about 100 awards a year. Then we have the 6-month fellowship in retinoblastoma in collaboration with the Eye Cancer Foundation with about 6 awards a year. We have 1-year fellowships in collaboration with the Retina Research Foundation, 2 awards a year, and in collaboration with the Academia Ophthalmologica Internationalis, we offer a research fellowship, also 1 award per year. On that slide, you can see where our host centers are located. Currently, we collaborate with more than 100 host centers in 30 countries. The majority of them is in Europe and in the United States. So here are the locations of our host centers in the United States. It is pretty impressive. We have a lot of high proud university clinics, eye clinics that support us. Since we are a European initiative, the majority of our host centers actually is in Germany, and we have 41 centers in Europe and in Turkey altogether. On this slide, you can see where our fellowship program actually is known. The countries that are in red are the countries where we have host centers. The countries that are in yellow are the countries where actually our candidates come from, and the ones that are striped in black and red are so-called hybrid countries. This is where actually our candidates come from, but where we also have some host centers. On this list, you can see where the majority of fellows actually train. So about 25% of our fellows actually train in India. More than 80 fellows train in the United States and 53 in UK. And in Germany, it were 65. So these are numbers that come from since we started the program in collaboration with the Ophthalmology Foundation in 2021 after the pandemic until now. Altogether, we had 420 fellows so far. On this slide, you can see where actually our candidates come from. A lot of candidates come from Yemen, from Turkey, from Nigeria, Ukraine, from Indonesia, from India, from Egypt, and from Ethiopia. But we're always very, very happy when we can add new countries to our list. So please help us spread the news about our program in countries that are not yet on this list. So what are the most favorite subspecialties? The most favorite one is cataract surgery, which, as I mentioned before, can be served in India in some institutes where our candidates can obtain a temporary recognition of their local specialist in ophthalmology degree and are then allowed to actually perform surgeries under supervision of experienced trainers. So this is really a very effective program, and a lot of candidates are eager to learn cataract surgery in India. Then glaucoma, pediatric ophthalmology, cornea, oculoplastic, vitretina, and medical retina are the most favorite subspecialties. But also we have candidates for neuro-ophthalmology, uveitis, ocular oncology, ROP, pediatric retina, retinoblastoma, ophthalmogenetics, and a few also for low vision and rehabilitation. So what is the application process? Candidates are eligible when they hold nationality of and are permanently based to live and work in a low resource or underserved country. They are under 40 years of age at the time of submitting their application. Our candidates have completed their residency training and have obtained a specialist in ophthalmology degree in their country. They come with a strong recommendation from their previous and their present chairperson, and ideally they hold public services and teaching positions or teaching positions. They are committed to resume their positions after the training to apply the newly acquired skills and knowledge for the sake of their patients and to teach their colleagues. It is very important that they have a very clear idea of what aspects in their subspecialty they wish to focus on and about what their daily challenges are that they want to learn about during the fellowship. The Ophthalmology Foundation examination finds strong consideration in our assessment. This is really very important, as you can see the examinations as kind of a knowledge passport, which gives your preceptor in the host institution a clear idea of what you are capable about. So we give up to 8 out of 35 points just for passing the Ophthalmology Foundation examination. The application process is pretty simple. You may gather detailed information on the program from our website. Then please fill in the online registration form and upload the requested documents. These documents are a scan of your passport, which should be valid at least for the next 2 years, a picture portrait. Then we would like a recent picture portrait in high resolution. We would like to see your specialist in ophthalmology degree certificate. Given it is not in English language, please attach a certified translation into English to it. Then we wish to see a confirmation that you have completed your residency training and 2 recommendation letters from previous and present chair. In these recommendation letters, the chairpersons may explain about your work responsibilities and your work performance. Very important is that you should pay special attention to your answers regarding your motivation, your expectation, and the impacts that you wish to gain from attending our program. This is these answers should be very well considered, should be explained in detail, because they are indeed a very crucial part of your application form, of your application file. After that, we can determine your eligibility, and we will return to you with an application summary, which you can then use to contact your favorite host from the EOFF-OF network. On the right-hand side, you can see how the EOFF-OF fellowship network looks like. And it is you who chooses your favorite host. Be prepared to go for a short interview with the host or the preceptor. And then the host has a few days to decide and suggest a period that will then be reserved for you. Please fill in the host notice of acceptance form, and once it has been duly signed by the host office, please submit it to us. Then your application file will be complete and can be processed for experts' review and funding decision. Our next application deadlines are actually July 31st and January 31st in 2027. Again, I would like to repeat that we consider the Ophthalmology Foundation examinations. Still now, it is a strong recommendation to sit them, but from the September intake on, it will be mandatory. We will hear about this a bit later. Here again is a screenshot from the host network. So our list is searchable by country, by city, by host institution, and by subspecialty. And if you click on the host institution's name, you see that they are displayed in green. Then you will receive a detailed sheet with further information about the specific host institute. Collaboration with the Ophthalmology Foundation examinations is very important to us, and we always recognize our current applicants who have set the Ophthalmology Foundation examinations. I think this is pretty nice if you find even more recognition there. Yeah, now we come to some experience reports. We have them in the gallery, and this is how it looks like. We have a picture of the fellow and the host or the preceptor, and some quotations from the fellow's report, which is nice. Also here, this is a lady from Ukraine. She served in Lublin and Poland and was sponsored by CBM. And here is a lady from Mexico. She served in Cologne in Germany and was sponsored by a German eye care company. And this is a fellow from Turkey. He served in Essen in Germany. And he was supported by the German Ophthalmological Foundation. And he served in ocular oncology department under supervision of Professor Bechrakis. So our funding actually comes from collaboration with the Ophthalmology Foundation, for which we are really grateful. They have a lot of industry partners, international US American industry partners, but also funding comes from German industry partners. It comes from German and international foundations and also from ophthalmological societies. So here, just a quick overview on where you can find information about the program, where you can read some fellows' experiences, and where you find the host network. And if you've got any questions, please feel free to reach out to me or to Professor Seitz, and I'll be very happy to answer to your questions. Thank you very much for your attention. Christine, I'm moving on with the Ophthalmology Foundation examinations, right?
Yes, please do.
Oh,
Unless you would
thank
like
you.
me to.
So much information. Would you like to do that? No, I'm going to do that. It's no
Okay.
problem. Yes, sure. Okay, I just have to connect it with Zoom. Oh, a second, please. I'm sorry, I'm
Of
not so
course.
familiar with that. So here we are, and then freigeben, and then move up. Okay. Okay, ladies and gentlemen, this is a quick overview on the examinations program. It is, it can be described by high quality for low cost examinations. It is, you can discover new online examination standards. They will be available at all centers nearby. They are designed to elevate your knowledge to global standards. And the examinations team is happy to bring the exams to wherever you are based in the world. Sessions for the examination are held twice a year. In the registration for the September 2026 exams is open still and will close end of July. And for the August 2020, sorry, there is a typo. For the August 2027 intake, it will be March 27th for the closing of the registration. Currently, we collaborate with 76 centers in the world. And as Christine mentioned before, we have very strong partners, for example, the Wills Eye Hospital in Philadelphia and the Wilmer Eye Institute in Baltimore. And this certainly underscores the global relevance of these examinations. So the examinations are recognized certification to enhance your professional credentials. The Ophthalmology Foundation exams are meticulously crafted to align with the American Academy of Ophthalmology's basic and clinical sciences standard and the professional requirements in the field. So you really see that this is a very high level. Content is created by US and other international experts in every specialty within ophthalmology and is revised periodically. It allows to compare how we perform with other institutions within our city, country, and globally. It's criterion referenced, and we use the Angoff method of standardization for it. A very big plus, and I think a very good teaser, is the David and Molly Pyatt Foundation Travel Grant, which goes to the highest passing candidate from either the March or the September sitting. in the ophthalmology clinical sciences examination, and it goes with an award of $10,000, which can be used as you wish, for example, to attend a global ophthalmology congress, the ARVO or the AAO or others. You can use it for specialized training programs or for research opportunities. It covers travel, registration, and accommodation costs. So I think this is a very nice teaser, and we are very happy that actually a few candidates have already won the foundation travel grant from David Molly Pye Foundation. Christine has also shown this slide. This is where we have our partnerships, and also we offer I can't pronounce the word, reciprocity with several international and national examinations. What are the benefits of the Ophthalmology Foundation exams program? Actually, it's a flexible online format that allows you to take exams from everywhere. It's the most modern examination in ophthalmology currently, and it's a benchmark. It benchmarks the institutional and trainee performance locally, nationally, and internationally. And of course, it's a pathway to the fellowships. So if you take the Ophthalmology Foundation examinations, you will earn valuable points towards your application for a fellowship. So as mentioned before, 8 out of 35 credits are given for the OF examinations with distinction. And from September 2070 on, September 2070. Yes, they will be mandatory to pass. It will be mandatory to pass at least one section of the ophthalmology exams to be eligible. For those who have passed all 3 examinations, we give the postnominal, the FIOF, Fellow of the International Ophthalmological Foundation, and of course, it enhances the quality of patient care and patient education, doctor's education, sorry. Here are some details about the examinations. So the visual sciences goes with 120 questions. It's single best answer, and it's a 3-hour paper. Subjects are anatomy, embryology and development. It's genetics, biochemistry and metabolism, pharmacology, imaging and digital ophthalmology, and of course, ophthalmic pathology. The second one will be the optics, refraction, instruments. These are also the subjects for this paper. It's a single 60-question, single best answer question paper, which takes 1.5 hours. And then we have the clinical ophthalmology examination. It's 160 questions in 4 hours. Subjects are neuro-ophthalmology, pediatric ophthalmology, orbit, cornea, and external diseases, uveitis, glaucoma, cataract, retina, and community and public health. It is also about general medicine related to ophthalmology. So also we are happy to offer more of these webinars. The next ones will be tomorrow in collaboration with the SynJab Academy. There will be one next week, and the next one will be in early May. You can always download the recordings of these sessions from YouTube, and you can register for future webinars with the Ophthalmology Foundation. Thank you very much for your attention.
Wonderful. Thank you so much, Cordula, for both doing your program and the examinations. That was a lot of talking all at once for you. So thank you. And we're going to move on. I'd like to introduce Dr. Diane, who is currently doing her fellowship in Germany at the moment. And we're excited to hear from you.
So yeah, am I coming through clear?
Yes.
Yes. Thank you, Miss Christine, for the introduction. Waiting for the PowerPoint. Okay. Good afternoon, everyone. So my name is Dian Astriani. I'm from Indonesia. It is a great honor for me to share my journey as an IOFF fellowship participant and right now at the Ludwig Maximilians University in Munich. Next slide, please. So currently I work at Tangerang Regency General Hospital, Indonesia, where I manage a wide range of glaucoma cases each day. In my daily practice, I perform glaucoma procedures from lasers to surgeries, but however, I'm also aware that glaucoma management is continuously evolving and there is still much for me to learn. Next. My motivation to apply for this program comes from the real challenges I face in my community. Tangerang is a suburban area in Banten province, but still many of my patients are low in economic and also low education level. Thus, they have low awareness of glaucoma. As a result, we often see patients presenting at advanced stages and sometimes with irreversible vision loss. In addition, access to subspecialty care and newer surgical techniques, especially minimally invasive glaucoma surgery, is still limited in Indonesia. And this situation motivated me to seek for further training so I can provide better care for my patients. Next slide. So this is my learning goals. I hope from this fellowship, I can gain exposure not only to advanced surgical techniques such as the minimally invasive glaucoma surgery, but also to refine the trabeculectomy, the more traditional surgery of glaucoma, and also to understand how expert approach complex decision making in glaucoma cases. I was also very interested in improving my interpretation of glaucoma imaging, such as the OCT and also visual fields, and learning how a structured glaucoma service is organized in a high standard setting like in LMU. Next slide. So this is the Ludwig Maximilian Universität München Augenklinik. This is one of the leading tertiary eye center in Germany, and it was established around 19th century, so it's already over 150 years old. It combines rich academic history with a modern clinical and research environment, and this department is well known for its strong focus of innovation and also high quality of patient care. Next slide. So now I am currently at my 4th week of fellowship. And so far my experience at LMU has been truly exceptional. I have the opportunity to observe glaucoma ambulance. It's the term for glaucoma clinic, where I could see a wide spectrum of cases and structured patient management. This is my preceptor. At the middle, I'm very fortunate to be mentored by him. This is Dr. Makert, and also there's another one, Dr. Kaidel, who are incredibly welcoming, supportive, and always willing to share their knowledge. And their guidance really made a significant difference in my learning experience. And also, Dr. Makert is one of the inventor of the iMate implant here, which reflects strong innovation and research culture at LMU Augenklinik. I'm also able to observe a broad spectrum of glaucoma surgeries, from the conventional to the newest techniques such as minimally invasive glaucoma surgery and also the less invasive glaucoma surgery. Next slide. I am very impressed by the advanced and detailed interpretation of glaucoma imaging like OCT and visual field analysis, which allows for very precise assessment of glaucoma. And every morning, there are also teaching sessions and clinical discussion where cases and journals are reviewed. So in the picture we saw here, this is the ward and also the diagnostic instrument for glaucoma. Next slide. Yes, last week I also have the opportunity to attend Retina meeting hosted by LMU. And beyond the scientific sessions, I really appreciate the chance to interact with peers and staff. And there's resident and also the nurse, the operator, and this is the nurse and the OR, and they are very kind and helpful, and I even make new friends. And I am also very glad to have the chance to meet Miss Cordula in person. It was a truly a pleasure and made this experience even more memorable for me. Slide, please. So after completing this fellowship, my goal is to bring this knowledge back to my institution. I plan to improve my surgical skills and apply more refined techniques in glaucoma management. I also aim to develop structured clinical pathways and share my knowledge with my colleagues and students through teaching. And ultimately, I hope this will reduce the need for referrals to distant tertiary centers and improve outcomes for my patients. Slide. So this is the city of Munich. Beyond clinical training, Munich itself has been a truly inspiring place for me, rich in cultural heritage and also academic excellence. And living here for 3 months will give me not only professional growth, but also personal experience that I will always remember. Slide. I would like to express, slide please, sorry. Yeah. I would like to express my sincere gratitude to IOFF, OF, and also Ian Trek for this invaluable opportunity. And I am also deeply thankful for my preceptors and colleagues at LMU, especially Professor Pricklinger, Dr. Mackert, Dr. Keidel, and also to Ms. Cordula for all of your support. And this experience has been truly meaningful for my professional growth, and I am committed to using it to improve glaucoma care in my community. Thank you very much for your attention.
Thank you so much for that presentation. It was
Welcome, my pleasure.
really wonderful and just so descriptive of your experience. So I hope that that was helpful for everyone else joining us today to
Hopefully,
learn
thank
about.
you.
And I hope the remaining couple months
you.
is just as good as it has been
Yes,
this first
time
month.
flies very fast, too fast. I don't want
Yes.
this to end, actually.
Yes.
2 more months to go.
Wonderful. Well, thank you. So now we are going to move on to our Q&A session. So as I mentioned at the beginning, please input your questions into the Q&A chat feature. And then we also received your questions when you registered. So Jody and Cordula will be going through those right now while we wait for you to submit your new questions now that you've learned more about the program.
Yes, so we can actually start with a few that came in through the Q&A already here, so I can start with those. So the first one, Cordula, if it is possible to apply for a fellowship when currently in last year of residency training, or do they need to wait until they're completely done with the residency training?
Actually, since the completion of the residency training and the obtaining of the specialist degree is mandatory, we would like to ask everybody to wait until they fully meet our criteria for being eligible for the fellowship program.
Okay, great. And then the next one is an exam question, so potentially either Cordula or Christine might be able to answer this. For people who took the COEXA exams, is there a possibility of grade conversion from COEXA to OF exam? And also I can put in the chat, we have a COEXA exam partnership page on our website, so I will drop that in the chat too for anyone who's interested.
Yes.
So,
go ahead, Cordula.
Oh, no, go. Okay, okay. So if a candidate has taken the COEXA visual and optics and refraction instruments examination, they can progress straight to our clinical examination and vice versa. So the visual pathway in this link can help explain it in detail. So here on the bottom, you can see where Jody has already put the link. Yes, it is possible.
Yes. So there's reciprocity for the first two exams, but the clinical is separate at both COEXA and the Ophthalmology Foundation.
Okay, great. So then the next question is a two-parter. So I'll ask the first one. Is there any plan of the idea of maximizing the training by hands-on skills instead of observerships? For example, by facilitating hybrid training where the trainee gets a few months of observership followed by direct exposure in his or her home country.
Mm-hmm. Well, generally speaking, I would say it is a great idea, and I think in times of growing AI experience, I can well imagine that at some point this will be possible, but we as the EOFF cannot offer this type of training. Maybe later on in collaboration with the education programs from the Ophthalmology Foundation, we'll see. Please keep posted, please keep in touch with us and ask from time to time, and we hope that we will have a positive idea at some point for you.
Okay, and then the second part of that question, does the score rank from the exams count for the IOFF application? Is it just the same 1835 for the first scorer and the last score of a given cohort?
So yeah, Christine?
To clarify, I think the question is, does it matter what your score in passing the exams is as far as the benefit to the fellowships application? Do their point, the levels of points given on the fellowships application, does that reflect how well they did on the exams?
So actually, I hope I got your question right. It was a little confusing.
Yes.
Actually, if somebody sits the Ophthalmology Foundation examinations with a very high result and earns a distinction or a merit, then we give extra points for that. And so if a very good result in the Ophthalmology Foundation examination is actually reflected in the application or in the assessment for the fellowships program. Does this answer the question?
Yeah.
Okay.
So rather than the
Yeah.
particular score, it's did you pass with distinction or not, is what would be reflected in the points given on the fellowship application.
Absolutely. Yeah.
Great. We got there together.
Thank you for your support, Christine, for translating.
Yes.
Okay, so the next question in the Q&A, is it essential to have recommendations for eligibility? It's theoretical paper, or do we have options?
So actually, we request two recommendation letters, and they should come from the present chair and from a previous chairperson, or also from a previous supervisor or the residency director. And we would like to learn about your work responsibilities and your work performance. So the letter from the present chair should be current, and the other one can be older. So we are not asking for an experience sheet, which kind of lists the stages you went through in your education in ophthalmology. We are asking for a recommendation, a written recommendation. Yes.
Okay, great. So the next question is, I would like to kindly ask about the age requirement. Many of us cannot pursue specialization immediately after MBBS. I recently completed my PhD at 39, and most fellowships require applicants to be under 40. In addition, there are required exams that need time for preparation. Would it be possible to consider extending the age limit to 45 to give us a fair opportunity to pursue subspecialty training?
Actually, we have an age limit of 40 years of age at the time of submitting the applications, but we are a little bit flexible when it comes to the age limit, and it will depend on a special case. And if you want us to find an exception for you, then please contact me directly, and we can discuss your special case.
Okay, and then the next question, is it possible to apply for a fellowship for someone who isn't a COEXA fellow?
Of course. Yes, of course.
Right, easy answer.
Yes.
Okay, and then another question. I'm interested in medical retina. I hold FRCS Glasgow, FCPS Pakistan. My age is 54. Can I join this program?
Um, I'm very sorry. 54 is a little above, is too much above the age limit. 54 is not possible. I'm sorry.
Okay, and then the next question, we might have answered this already. Is it possible to convert the COEXA clinical or practical exam to the OF clinical exam results?
Yes, it
Yeah,
is. Yes, we have answered that before.
yeah.
If someone has already taken the COEXA visual and optics and refractive instruments examination, they can directly progress to the OF clinical examination and vice versa. And Jody has published the pathway, the visual pathway.
Yeah, and then they also asked, is it possible for a COEXA fellow to become a FIOF by converting their COEXA exam?
They still have to take the
Yeah,
Ophthalmology Foundation clinical exam to get FIOF.
yeah. Okay. And are
Exactly,
there any
yes.
programs for ophthalmology nurses as well? Are there recommendations?
I'm sorry, our program actually addresses to ophthalmology specialists, and unfortunately, we cannot consider optometrists, nurses in our program yet. I'm
Okay.
sorry.
So those are some of the questions that came in through the Q&A, and then we have a few other questions that were pre-submitted or questions that other people might be interested in. So Cordula, what is the most important part of the application, and about how long do you think it takes to complete the application?
So I would say the most important part is to have a clear idea of what somebody wants to learn, of what somebody wants to focus on during the fellowship. As Dr. Diane clearly explained her motivation and her expectations, I think from that we have seen that it is important to have a good idea. And after that, it is important to actually find a host who is ready to accept you as a candidate for the fellowship program. And putting together the application file probably doesn't take very long. It may take 2, 3, 4, 5 weeks to find a host. But generally speaking, I would say an application file can be completed in like 6 to 8 weeks from the very start of registering online to the final submission of the completed host notice of acceptance form. And you should, as a candidate, you should consider that it probably takes a year from starting the application until serving the fellowship, because you should keep in mind that it is always takes some time to apply for a visa. And this actually takes more time than we always think it takes.
Okay, now it looks like a few more questions came in through the Q&A. So this is kind of similar to what you just answered, but what makes for a competitive application? Does that include publications?
Yes, we also ask for publications, and we consider them. We also ask for your research activities, and we also credit publications and credit and research activities, as well as conference activities if you're a presenter or if you're a participant. So these are all criteria we are checking in the formal assessment for the fellowships program. Yeah.
Okay, and then another person asked, where are the exam centers for the clinical OF exam in Eastern Africa? And so I think for that we can get this person, I can put the contact for our exams team so they can give you more details about the exam centers that are in Eastern Africa. So I'll put their email in the chat.
And an important thing about exam centers is if there isn't currently one near your location, the team is really great about locating one and opening a new one for you. So to date, they have not failed to find a center for any candidates, whether we had one established already or they needed to organize a new center. So there is likely to be something for you wherever you are.
And then another question for fellowships, can we find a host center who is not already on the list?
So in that case, generally speaking, it is possible. In this case, I would like to ask you to send me the URL of the center that you wish to apply for, the name of the host of the preceptor and the contact data, please, and please give your reasons why you would like to choose this specific center. For example, if this is a center where you already know people at, then this is a very strong motivation for us to also approve of the center. So it depends on your reasons, but generally speaking, yes, we are flexible. And we're always looking for new host centers as well. So very good.
And I can put the link from the IOFF website of the current host centers that you have too. So if people want to browse that, they can. And then another question, do I need to obtain a visa for the host country and how do I get one?
Yeah, I think there are, in most cases, you will need to apply for a visa. And since applying for a visa is a formal and individual process, we can support you with a visa support letter if you were awarded a fellowship. But we can't really help with that. Usually it is you who has to apply for a visa interview and go for the visa interview and be convincing. But most candidates actually make it and obtain their visa well in time.
Okay, and then another Q&A chat question. This was sort of answered, but are there any opportunities available for doctors who have not completed residency yet?
Well, in this case, we ask you to complete your residency first, to obtain your specialist degree, and then contact us with your fellowship request. Yeah.
Okay, and I think that concludes all the questions that have come through. Thank you for answering.
You're most welcome.
We had some good ones
Yeah.
today. So that concludes our session today. Thank you everyone for joining us. I am going to pop up on screen some links, how you can get in touch, QR codes, if you just want to scan that and have that on your phone. And as we said earlier, the recording will also be emailed to you within the next day or so. So you can review this and the answers to the questions if you need a refresher. Thank you, Cordula, and thank you, Dr. Deanne, for joining us today. It's lovely to have you.
Thank you for giving us the opportunity.
Yes, very good.
Thank
And
you.
thank you, Jody, for leading the Q&A. That's always fun. But thank you all for joining us. And we were happy to have you today. And I will share our contact information. So
Yes.
access to the IOFF website and the Ophthalmology Foundation website. You can find details on everything that was discussed today on both sites. Please feel free to reach out to either Cordula directly or to the Ophthalmology Foundation, and we will get you the information you need if you're not able to find it online. And, join us on the socials if you are on them as well. We continually update on our programs, on experiences of those who are taking fellowships, taking exams, participating in our faculty development. And we look forward to seeing you in the future, either in person or online. Thank you all.
Thank you so much.